our series, Experts at Home, and I am really excited today to be talking to a good friend and colleague, Dr. Robert Neimeyer, and about a really important subject, I believe, during this particular time. You know, grief is always difficult, but it seems like under the circumstances we're living right now, it's even more complicated because people can't grieve in the ways they're used to.
Well, that certainly is well said. And we know it in our bones. We know it in our homes. We witness the effects of having to grieve, a perfectly normal human experience when we experience profound loss and transition, but under profoundly abnormal circumstances. And what we're finding in our research, as well as in our personal lives and our clinical practice, is that this can really shake us profoundly and leave us in a much more complicated place in our grieving than we otherwise might be.
Yeah. What have you been, so you've been seeing that people have been really struggling with dealing with grief?
Well, we have done several waves of research on this topic, Lisa, and we've had samples of 300 people bereaved by COVID, 800 people, 1,000 people. And what we're finding is very consistent across these samples. Everyone has lost someone that mattered greatly to them, typically a family member, sometimes an intimate friend. And in these circumstances, what they're telling us is that their pandemic grief is different in both quantity and quality from the previous kinds of losses they've known. I'd be happy to share a little more about that, but
yeah, I would love to hear more about that. So they're a greater they're having more grief, and then they're also, it's the quality of it's different.
That's exactly right. That what we have done is we've constructed something called the pandemic grief scale, and basically we looked at all of the symptoms of grief that are well recognized within psychology and psychiatry, the sense of yearning for the deceased, the sense of their absence from our life, the sadness that attends that. We had 36 such symptoms. And then we basically did a kind of study that helped us identify what would be a handful of items that when people endorse them about their grief having this kind of quality at this intensity, tells us that they're really struggling to function in their family contexts, in their work lives, in their social world. And so it's in that sense that we're looking at pandemic dysfunctional grief, right? The dysfunction that comes from not being able to, to really perform in these important roles. We can't function as a partner or a spouse. We're not able to stay on top of our kids' needs. And so we have determined these 5 items that when people endorse them, they're much more likely to struggle mightily to get their feet back under them. They include things.
What kinds of items are those? What are the things that make it harder for people?
Some things would include factors like a death wish. I just wish that I were dead so I could be with my loved one again. Another would be the inability to access positive, consoling memories of the loved one. It's like it's so overshadowed with the experience of a traumatic death that it's hard to really take it on board. And we also conducted another study that is now in press that looked at pandemic grief risk factors. What are the circumstances of the loss that configure an especially difficult grief, that leave people struggling with a sense of meaninglessness and emptiness, these pandemic grief factors. And what we found is we identified 10 factors that are very characteristic of loss in the COVID era, especially when our loved one dies of COVID-19. And these include things that many of us would think about, many of us talk about when we've suffered these losses. Factors like being unable to be there for the loved one during the time of dying. We can't sit in that uncomfortable vinyl chair alongside their bed and talk to them about their life and move toward a place maybe of forgiveness where there were tensions in the relationship, and really honor and value and support them. We can't comb their hair, we can't see their smile, they can't see ours. If anything, we're limited to a few minutes of highly mediated contact as a chaplain or social worker kind of risks his or her life holding a phone to their face while they may be on a respirator, and whether they're conscious or not is an open question. So these are terrible circumstances. We look at that kind of thing. We look at the way in which people are isolated in their grief as a function of the highly necessary social isolation practices to mitigate contagion. We looked at the way in which, as medical care systems, healthcare systems, struggle greatly with this grief, the quality and quantity of the contact between the facility, the doctors, the nurses, and the family is, all of the family-centered care that we've been developing for decades. It's like it's rolled back to the 1950s with family excluded and often uninformed. So those would be a few of the factors that we consider. Also, traumatic imagery of struggling with the image of the loved one, struggling for life on some machine, right? And a period of weeks of ventilation with in a medically induced coma. These are horrific images that, people who have suffered loss of this kind, as many of us have, really struggle with in our waking thoughts and also in our nocturnal dreams. So that's why we speak of pandemic grief, because it has all of these special qualities in addition to those core feelings of emptiness, of yearning, of missing the loved one's physical presence. It's freighted with a lot of additional baggage.
Yeah. And some of those things are true, even if the loved one in this time didn't die of COVID.
That's exactly right.
I know a lot of people have lost loved ones
That's right.
who weren't able to be there because the hospital won't let you in, even though the family member might not have COVID.
No.
And also where the doctors are so overwhelmed, they're not spending that time, or, there's
Precisely.
not that.
So, yeah, I mean, just as you point out, even though our research has focused on COVID losses, in some sense, it is grieving in the time of COVID that is the primary challenge. And that may be true if our loved one dies of COPD, right? Struggling for breath, whether they die of congestive heart failure, whether they die of cancer, of dementia. All of these modes of death, which would have typically allowed us to really tend to the loved one, to draw close, to bring the kids in to visit mom, dad, or the grandparents at the time of in the course of treatment. All of those chances are denied us. And with them, we also find that a lot of people who come from a more spiritual walk also experience a sense of almost abandonment by God or punishment by God. This is another of the risk factors that emerges that predicts this anguishing grief and functional impairment in people's capacity to deal with their life and family responsibilities, their work roles. The sense that this is a kind of plague visited on humanity by God or the universe to punish us for our wrongdoing. And so we end up with two problems for the price of one. We've got a complicated grief and we've got a complicated spiritual grief.
Yeah.
So these are all factors.
Yeah, that make it really difficult. And then the things we do, that sometimes help us, work through our grief, like a funeral or a family gathering to celebrate the life of somebody. Those things aren't happening either.
That's right. To give you an example, I talked with a friend of mine last night for about an hour and a half, and she is an Orthodox Jew, a member of a very close-knit family and close-knit community, a large family. And her father died 2 weeks ago of COVID. Of course, from the time that he went into hospital, they could not see him. He was ventilated for 3 or 4 weeks. And of course, during that time, the contact was limited to that cell phone held to the face of the comatose father, while my colleague, my friend, would apportion the 15 minutes that the hospital protocol permitted the chaplain to be in the room in order to mitigate the threat to his health by being in the presence of a COVID patient. He could be there only 15 minutes and then out. And so she had to interview all of her siblings, 6 siblings, decide who had the greatest need to engage in a deathbed conversation with Dad. And as part of that Orthodox tradition, there is this a ritual of seeking forgiveness for maybe failing to honor the parent at the time of dying. So the sibling who had the most complicated grief, she allocated 7 minutes to. The one with the next most complicated, 4 minutes. A third one, 3 minutes. The others were silent witnesses as everybody is on the Zoom screen in their respective square, accompanied by their spouse, and they mute the sound in order to give the people privacy to lean in and say to the father, wearing his kippah and also his ventilation, to say those final precious last words. And meanwhile, they're counting the seconds. Okay, time is up. At least it's your turn. This is inhuman. Whatever our tradition is, we feel that we fall short. And of course, it comes at a time that if people are involved in a faith community of any kind, those communities are typically shuttered or they're online only. So the level of support we have is far, far too low for the level of challenge that we face.
Yeah, and hard to make, those meaning-making parts of our grieving process are being interrupted. And I know that you do a lot of research on meaning-making in loss too.
Yeah, and so it's worth asking just what do we mean by meaning about this? And I think we mean a number of things, really. If we see human beings as maybe set apart from most of the animal kingdom by our tendency to want to be able to understand what's happening to us, to narrate it, to be able to tell a story about what we're experiencing, to be able to communicate verbally in language, all of these ways, we're storytelling beings. We live our stories as well as tell them. And when our life stories get really broken or assaulted by a loss that has a traumatic impact on us, then we often are trying to do a couple of things. We're trying to process the event story of the death or loss itself to say, what happened here? We're trying to wrap our head and our heart around this. How do we explain what has happened in our lives as a family or in relation to this important other? And what is its implication for my life going forward, right? And because that impact of a very unwelcome change often shatters our view of what the world is or should be, we need to have a trauma-informed grief therapy that looks at the traumatic impact of these losses on us. Yeah. So I think of that as the focusing on the event story of the death and its meaning. But there's another aspect, and that is the backstory of our life with our loved one that we look to have some way to bring forward now. Like, how now do I maintain a relationship across the divide of death? How do I accommodate that very present absence of my loved one in the empty chair on the other side of the breakfast table, or in bed with me at night where it's just an empty space where, previously I had my partner there. And so in all of these ways, we seek often to reactivate that story of connection, not to relinquish it, but to reconstruct the bond of connection. Or when the relationship was complicated or ambivalent or conflictual, we often need to bring forward those stories, sometimes with a therapist, in order to sort out the difficult residue of a difficult relationship. So that's what we think of in terms of meaning making. We're trying to make sense of the death and ourself in light of it. And we're trying to make sense of the changed relationship to the deceased and how it plays a role in our ongoing lives.
Yeah, right. And both of those involve telling stories and usually talking, through. And that's harder for people to do than it has been, given the circumstances, just,
that's right.
The safety measures that we're all still taking.
Right. And so we can have meaningful dialogues in a video conference form. We have Zoom, we have Skype, we have other meeting platforms. And of course, when the stories are too hard or too complicated for even our friends or family to hear, we can have the comfort and consolation of a therapist or counselor who ideally has some significant training in grief therapy and doesn't just mistake grief for depression, which really sells it short and medicalizes it. And so we do have recourse, but as you say, it is more complicated. It's harder. We don't have those natural, spontaneous exchanges. I think again about my friend who's the ultra-Orthodox Jew sitting Shiva. And of course, she can't do that in her home now with the family, her mom, her siblings, and have people come and spend a whole week sharing remembrances of the father who had died. Now she's out shivering in the cold, in the midst of an ice storm, and people come up and they bundle up, and behind their masks they say a few words and then they retreat again to warmth as the family shivers as long as they can, and go back inside. And so even these rituals that are intended to richly support our sense of a continuing bond and honoring the deceased can be so changed. Our online Shiva, which might be beautifully conducted, but it might be very disorganized and unsatisfying.
Right. And it's difficult, and how you make those decisions. I talked to John Draper, who runs our National Suicide Lifeline, earlier in the pandemic, and his mother died, and she was in Houston. He was in New York. He couldn't go. He couldn't be there. He couldn't. They did do an online funeral, and he did find that gave some meaning. Writing what he wanted to say, being able to say it in front of people, who knew her, helped him some. But it's not quite the same as being there.
That's right. Yeah, and it's a far cry from a human hug, right? And that receiving line after the funeral, and whether one is secular or spiritual, it's a common practice that there are people who safely can embrace us, but now there are very few. And we are much more atomized, each in our own little square on the screen.
Right. And that just doesn't have that same comfort of human touch.
Yeah.
Even though the words are important and some sharing of it.
That's right. And so I do ultimately believe that human beings are resilient and resourceful and creative, but we are working against great disadvantage here. And I think it is important to acknowledge the challenge, even if we also accept it and commit to the idea of doing better. The reality is that we are facing now, even as we begin to get the viral pandemic under control, we face a shadow pandemic of grief that for which there is no vaccination.
Right.
No vaccine for this. This is something we're going to have to work out on human terms, within us and between us.
Right. And I think, if we think of the magnitude, just because there's so many more people lost due to COVID, it's going to be a magnitude, at least in our country, of significant proportion.
Well, when, again, this has become a tired metaphor, but it's worth considering that, throughout the 20th century, we consider the number of American lives lost in the First World War and the Second, Vietnam, all combined, are exceeded now by those lost in the pandemic. And, it took the entire war effort of the Central Powers in World War I, of the Wehrmacht and the Japanese Imperial Army, Navy, and Air Force in World War II, plus the Viet Cong, to take this many American lives. And it took about 12 years for those wars combined to do that. For us now, in 12 months, we have lost more than that, to a kind of faceless enemy. And many of our standard responses, like to, fight or flight in the face of threat, there's nowhere to flee. There's nothing to fight against. there is only a sense of pervasive helplessness and anxiety, which gradually now is merging with grief.
Yeah, yeah. And it's just such a magnitude that it's kind of hard to get your mind around. And so, all in one time. And for some individuals, it's losing multiple family members, and that also has got to be really difficult, to lose both parents at the same time, might not have occurred otherwise, or to lose a sibling and a parent.
Right. No, it is horrific, and the toll is enormous. And of course, it is also not distributed equitably across cultural groups, is it? We know that COVID deaths are disproportionately concentrated in brown and black communities. Those may be least well served by healthcare and so on. And living conditions also foster greater proximity and hence greater contagion. And there may be more health challenges that leave people vulnerable to begin with. And so it becomes a psychological, a political, a communal, and in some sense, a kind of spiritual or philosophic challenge or crisis for us.
Yeah. And how we're going to provide the services that people need for all of that is going to be a real challenge. Because it's not an area, like you said, that all therapists have training in.
That's right. In fact, it's almost fair to say that no therapists do. That's an exaggeration, but my estimate would be that 5% of psychotherapists are adequately trained to deal with complicated grief or traumatic grief. Mostly, and the point is that it's not any fault of our own. It's simply that our graduate programs provided no training or a 5-step stages of grief model, a la Kubler-Ross 1969. No evidence base for it, and very little, practical implications of it. We have good models and methods now, but they're rather different than treating people for just depression or anxiety or, other things that may have relevance in this. But it doesn't go to the broken heart of bereavement, where these attachments on which we depend to get through our lives, the secure basis for our lives provided by these relationships, are sundered.
Mm-hmm.
And that requires a different kind of conceptual frame for the therapist to work within, to understand what might the client need here. In fact, you mentioned meaning making. I think a big part of what we need to do in grieving is to be able to make meaning, to make sense of our own internal experience. What do my emotions now tell me about what I need now? And how can I practically do the brave and hard things that are required? Maybe it's reaching out for someone who really understands. Maybe it's revisiting a place that I used to go a lot with my loved one, but now it feels like it's radioactive. There are real behavior changes that are often needed in bereavement, just as there are real psychological challenges. We try to not so much relinquish our relationship to the one who has died. We typically try to reconstruct it, rebuild it, to say, what role do they play in my life now? How do I love them in absence? And those are subtle things for which many therapists are pretty unprepared by their training.
Yeah.
So
and plenty of therapists must be suffering these kind of losses too. I mean,
well,
yeah. From losing
that's
people.
right. I appreciate you bringing that up, and of course you do this as I do. We have our scholarly hats that we wear at times, but we are also practicing therapists, and we're practicing human beings. And so we recognize that when we enter the terrain of grief and loss, we are standing on the same level playing field that our clients are on. We're not standing on a higher mountain and looking down on poor suffering humanity. We're in the valley with them. We're walking through the same quicksand. And that means that we need to also be doing our own work, attending to our own losses, We need to practice self-compassion and self-care in addition to other compassion and other care.
Mm-hmm. Yeah, and I just think that's really important. I think, it could be hard for people to give themselves the time and space to really grieve. And I think, the pandemic is no exception. And sometimes people have now heaped on them, in addition to their work, more family chores, more trying to school their children or take care of others, and giving time and space for grief seems so important.
Yeah. Also, this is a kind of model I think is useful. There are a few. I mean, obviously the meaning making model I described is, I think it's really helpful for me to see what I need to be doing in relation to grief. But another is called the dual process model of grieving by Maggie Strobe and Henk Schut in the Netherlands. And basically they say that within the context of our lives as bereaved people, we have we oscillate, we go back and forth between two orientations. We're oriented to the loss on the one hand and to restoration or life on the other. And we sort of do a pendulum swing back and forth from loss to life, to the loss to life. Each has its own challenges, but what in the COVID context, we lose that natural kind of balance, that oscillation, because life exists in such a diminished way that, for example, we've been doing some research of a qualitative kind with Belgian parents who have lost a child, and they're grieving in this time of COVID. So the losses may have preceded COVID, but now it's during this past year that they're enacting their grief. And so what they tell us is that initially there's kind of a relief because the social world diminishes or goes away. So they can be in their grief. They don't feel any press to put on a happy face and enter the social world. But soon enough, that begins to produce a real imbalance. It's like they're in lockdown in their home all the time. That empty bedroom down the hall keeps calling to them. The pictures of their kids on the walls surround them 24/7. They're not going in to the office. They can't go to a football game or a concert. And so essentially that whole restoration piece in which we naturally will oscillate to meet our needs as grievers and to meet our needs as living people, it's like that goes away and we're just in loss 24/7 with the others who are most affected by the same loss, that is,
Right.
partners or families. And so it's in that way too that the circumstances complicate our adaptation. They take away a lot of our coping resources.
Yeah. I've seen that with, we had a close friend that I grew up with, and I know his brother really well, and he died right before the pandemic, suddenly and unexpectedly. And, we had all set to have a ceremony and to, get together with all of his siblings and my siblings and anyhow, and families and, to grieve him. And then it got canceled because of the, pandemic started. And we were in lockdown mode. And, it now it's been a year, it was on Super Bowl Sunday. So there's, this big reminder because, kind of hard to forget Super Bowl Sunday. And just very hard,
Right.
for all of us who didn't get to do what we would have done.
That's
And
right.
like you said, there isn't the distractions of real life, connecting with life, of the things that make us glad to still be alive, to have some joy and a moment of distraction or peace,
Right. And also, it may sound simplistic to say, and we should also acknowledge that not all significant deceased people are loved ones, right? Some are ambivalent ones, some relationships are complicated, but part of what dies with that person is the chance to somehow make it better.
Mm-hmm.
So they may have them die in a position of cutoff, and the bad feeling can continue on from that point. But typically when the person we've lost is someone we do love, then of course we are comforted by the opportunity to gather together, to share the stories, to have our loss recognized by the community, but for the community to still welcome us, literally or metaphorically, with open arms. And then to also, of course, in the stories and the anecdotes and the printed programs or the online memorials, we are giving honor to the deceased. Anything that helps us honor those we love will help us in our grief. Anything that silences those stories or dishonors them through marginalization or forgetting hurts us in our grief. And we have a world of hurt now.
Yeah, we have a world of hurt because we are feeling silenced or not able to share it in the same way. Like even when you're talking about your friend and, you know, trying to stay in the cold, shivering and say a few words through a mask, which are barely intelligible sometimes.
That's right.
It's just not the, you know, the long, you know, sometimes complex stories, right? Because most people are complex and we have complex relationships to them. And, you know, so they may be a loved one, but also one that there's some difficulty, or it might be a person that was very difficult in our life, you know, but it helps to tell those more complex, nuanced stories and to consolidate some of those meaningful memories with that individual that we shared. And lacking that ability to maybe fully do that seems like it's really been difficult for people.
Well, I think that that's insightful and an important piece that we stitch together the torn pieces of our lives with a narrative thread. We find a way of connecting the torn bits, and we weave stories that make them whole. And that means that doesn't mean that we just do a simple cognitive reframing. We make a happy face emoticon out of a crying one. But what it does mean is that we find at least some audience for a coherent story, one that includes even the nasty bits, the hard parts, the complicated parts of the relationship. And it's harder to do that now. I think this is part of what therapists can provide that the social world might not be able to, is to create a safe space or container for the restorying of these lives and losses.
Yeah. And I think being able to say the hard bits too is important. I think that can be hard even in normal times in the grieving process, because the tendency in eulogizing those we've lost or speaking of them is to want to focus on the good.
That's right. Even the word eulogy, of course, means good words, doesn't it, from the original Greek? And in the Portland Institute for Loss and Transition that I direct, we basically are a university without walls for training in grief therapy as a form of meaning reconstruction, meaning making. And one of the live therapy programs that we have coming up, a live training module, is by a Dutch-Canadian colleague of mine named Reineke Lengel. And it is specifically on the use of personal creative writing to address all of those taboo topics, like maybe the conflicts in the relationship with the loved one, the ambivalence in the relationship, the unfinished business that remains, or even the pieces like the joy that I have also felt in the context of my grief. That often can be marginalized. We can't talk about what we were spared by this loss, or if we lost maybe a partner, our ongoing sexual desire. What do we do with that? Well, that's also part of our emotional reality. So hers is a module that looks specifically at what might we do practically in terms of our own journaling and writing various kind of creative prompts for integrating these otherwise disowned or disenfranchised emotions in grief that are also part of our experience.
Yeah.
So there are many things we can do, but I think the average good therapist may not be aware of the rich toolbox of techniques that he or they could use to, to really address these needs on the part of a mourner.
And it sounds like the center that you run is really providing some of that. So these are like continuing education kind of programs that.
That's right. And these are, it's basically, these are at this point all online. We have a variety of core courses and then techniques modules, case studies, practicum opportunities, all of which are, affordable, and you can take them in any sequence you like. You may work towards certification or not, depending on your interest. But these are available online, just portlandinstitute.org. And there are other good organizations as well, like the Association for Death Education and Counseling, or ADEC, will be having a meeting coming up in April, and there'll be a variety of workshops offered for that. There's an Expressive Arts Summit that is coming up, a West Coast version of that. I think also in May, if I'm not mistaken. So one can be alert to these opportunities, but they are surprisingly few to really get high-level training of a kind that is experiential, where you can really try things out and get personal mentored feedback, and not just a webinar with a multiple choice test after it.
Which it's just not the same thing. No.
That's valuable too, but basically I think we learn by doing, especially when we're talking about the practices that can enrich creative kind of therapy or counseling.
Yeah, and I think especially when dealing with this difficult topic, because partly practice and experience of it makes it easier to talk about, and if the first time is with a patient, that's going to be harder, I think especially right now, it'd be a really important thing for therapists to avail themselves of, because of the fact that we are going to have this increase of grieving to deal with, with this huge amount of loss this year, of people in many, many, many people's lives,
That's right. Well, I have to tell you, I mean, your listeners may know that you also are going to feature a webinar on the topic of when grief goes viral, and I'll have the opportunity to talk with them more about some of the research and implications for clinical assessment and practice. But just one punchline from that is that, we've studied at this point thousands of people who have lost someone during the COVID pandemic. And what we are finding is that the validated mental health screener that we put together for dysfunctional grief is suggesting that 66% of the mourners are scoring in the clinical range on this scale. This is hugely more than a screening for almost any other psychiatric condition. We've not seen anything like this, but neither have we seen anything like the pandemic and the death toll it has taken at a time when people are least resilient as individuals and families and communities. We're very fragmented. So it's not surprising. I trust that most people will be resilient in the long term, but I would not be surprised if the level of prolonged and anguishing grief is not greatly in excess of what it used to be back in 2019.
Right. So as therapists, this is something that's very likely, for therapists, this is something they're very likely going to be dealing with, whether that's what think that they deal with or not. You know what I mean? That's the thing that always strikes me is, people say, well, this is not my area, especially, but people come to see you not necessarily because of that. And also, somebody you built a relationship with is now dealing with grieving. It's kind of, something you need to be able to deal with.
Yeah.
And be cool about.
Well, I'm reminded of a colleague of mine, a good behavior therapist, I guess, but he was supervising a graduate student, a doctoral student who was providing therapy in our clinic, and the therapist was getting kind of just uncomfortable because she came to me and said, Dr. So-and-so is recommending, my supervisor is recommending that I tell this mother that If she doesn't really get on board with our behavior monitoring protocols and reinforcement schedules, then I'll need to just stop seeing her in therapy. And I said, wow, that sounds like a strong thing. Yeah, but I just haven't been able to get her to do these things. And I know she's having all of these child problems. And I said, wow. And she said, yeah, I just keep thinking maybe it has something to do with the fact that these preschool kids' mother died 2 months ago. I just said, yeah, maybe it does. Is that something you've talked about in your therapy at all? No, not at all. My supervisor is telling me I just need to track the reinforcements of these kids and get the mother. And so, and it's not that, that the supervisor was a bad guy. It's just, the kind of frame for therapy that he had was too narrow to accommodate the reality of what this family was contending with. He had no category to fit grief into. So
Right.
it just translated into behavior problems. And the behavior problems are what the mother brought forward.
Sure.
So that's what got the attention. And so I think that happens a lot, that people are going to be bringing forward social anxiety, uneasiness about intimacy and closeness, a sense of being overwhelmed or experiencing emotions they can't really make sense of, or a kind of background sense of sadness or disorientation. And we will see that through the lenses we have available to us. But if those lenses don't include a pretty good focus on what it means to suffer hard transition and loss, we're going to miss a lot of what people are implicitly needing. So it's not just for people who come in saying, I need grief therapy. We need to be able to attend to people who say, I don't know what's wrong with my life. I haven't been able to get things back together again. My sleep's all messed up. We need to be able to look at this through a grieving lens as well.
Yeah. And I think it's a complex lens, partly because the relationships may have been complex. I know one of the things that I hear from people is their greatest fear, partly about this pandemic, is that they'll bring this virus home to somebody they care about who will die. And I know that that's actually occurring. Now, if that's the way we lose somebody, that's got to be an even more complex grief.
Well, an hour ago, I was talking with a reporter from the Washington Post, and she was telling me about her kid, little boy, 8 or 9 years old, who over this course of time has become real concerned about mommy and daddy dying. Now, they've not had COVID themselves, but he's marinated in the same world that the rest of us are. He knows he can't go to school because there's a dread disease, and he hears the names of people who have died, and in their social world, he sees the statistics, he's watching the television, and he is getting filled with death anxiety. And she's trying to figure out, how do I deal with this? And of course, he is in his own way attempting to process and make sense of all of these losses, both through death and all the non-death losses that we've had as well, right? Of a way of life, a social world, a sense of predictability, control. We have lost so much as well as so many.
Right. And I think there's a lot of grief about those losses too, and they may not feel, it could be easy to kind of minimize it to ourselves that it's not that important because it's not actually having lost somebody who died, but losing the world being the way it was as we know it, losing having contact or time with loved ones, not seeing grandparents or parents who are older, who we feel are vulnerable. And, where it might be the last few good years we have with them,
That's exactly right. Well, I think about that myself. It's been, 14 months since I've seen either of my sons or functionally my granddaughter. And, there will be a time on the other side of vaccination, I hope, where I can do that again, and maybe not, by the summer. but this will have been, a year and a half of not being engaged in their lives, at a time when now in my life, I don't know how many years I have left, but I've had a lot less of that than I would otherwise have had. And this is not uniquely Bob or Lisa's problem. It's nearly universal, unless we have the good fortune of having everyone we love as a member of our pod. But few people have that luxury.
People have luxury just geographically or practically, in terms of exposing themselves,
That's right.
I mean, even in our family where we do, my dad is 90, turned 90 last September. We've isolated him and the most vulnerable in our own population from us. Even though they're here, we take care of them. We provide them with resources, all sanitized, but we do not.
No, it's a far cry from the days on the boat traveling around the world together.
Our cry is we're sharing life together day to day. And, we do have a process to quarantine to go see them, but, it involves quarantining in isolation and 2 tests for COVID, and, pretty strict protocols. It may change as he's now gotten his 2nd vaccination, which I'm very glad about. But, I remember toward the beginning of this, one of my little nephews, who's 5, was thinking about the fact, his grandfather he can't see, but he was getting concerned that the pandemic was going to go on so long, his parents would be of that age group, and he wouldn't be able to see them.
Well, yeah, and one has to give consideration to what it must be like to be a young child, whether even a toddler, whose world gets limited then to the house during this critical developmental window, or that preteen kid who's plenty precocious and conscious enough to kind of follow the general story, but can't get to school, not able to have experiences with other kids in the neighborhood of what's it going to be like going forward for those kids? How comfortable will they be when they move into adolescence? How much will relationships and closeness generally, how comfortable will that be for them? Will they enter it with a sense of fear and vigilance and protectiveness? And it would be perfectly understandable if that happened more. So I don't think we really know the longer term consequences of all of this strange world of loss, the surreal world that we've been living in. Nor do we know if a couple of years from now we'll be dealing with not COVID-19, but COVID 2020, COVID 23, as we have all of these continued mutations. And so it's a worrisome future in that respect. But we do have a capacity for resilience. We are learning to live in this world. We are inventing resources that we need to get through it. So I'm not ultimately darkly pessimistic, but I am realistic about the psychological and social challenges entailed.
Right. And this is something, I think part of what made it hard to deal with this pandemic at the beginning is it was something that we couldn't imagine. I mean, it was something we couldn't imagine. We'd never experienced before in our lifetime. Very few people who are still around from when we had the Spanish flu, and the idea of shutting down on a large scale. I mean, that was really hard to picture that we were going to be there. I mean, now we've been there a year, but it's, and what kind of effect that was going to have and all the implications of it. I think we just had no idea. And like you said, if this were to come up again, now we do have a point of reference. And I don't know if that makes it better or worse. I think it's going to be difficult, like you said, and to see little kids see other people and that you got to stay away or this much distance. Or, wow, and it's hard to be socially distanced but emotionally connected when you're a toddler. Toddlers do a lot of their connecting through touch, and a lot of it through physical play, and
I think you're right. In fact, I mean, I would say all of us do. I happen to be living alone during this period of time. And so it has been essentially 14 months since I have been touched by or touched another member of my species, since I have sat down and prepared a meal for or with or eaten a meal prepared by another member of my species, shared a glass of wine, a conversation that wasn't mediated by this device. And so if I can feel that as I, move through adulthood towards senescence, how much more could a child or adolescent who is really craving that and doesn't have 50 years or more of previous experience to draw on? What's
Right.
that like for that being? It's got to be very tough.
Very tough. And I see it with adolescents in our family where, this is a time adolescents are usually kind of pushing away from parents and family and moving, as, yeah. And hard to do when you're in lockdown with your family. I've seen it with patients of mine who are college age who are all of a sudden back home with family that, where they already feel kind of like adults and don't want to be, and how much can they manage that? But it's very difficult.
Yeah, these are basic developmental tensions, right? Separation, individuation process that's just normative. It's part of our identity development, at least in this culture. But boy, it gets radically constrained and redefined. And that's why I say, beyond the immediate impact of people coming in, with a tissue in their hands and weeping out of grief, this is the obvious face of it. But that's like the tip of the iceberg that's above the sea that we can visualize. But this much greater mass beneath of all of these further implications and entailments, if we're not alert to those, then we're going to be a lot less helpful to our clients.
Yeah. Yeah. And so many people in your situation of just not even having, shared meals or physical touch or, interacting directly
Right.
with other people from our species, as you put it, with all being through screens. It's just not, I'm glad we have the screens that we do.
Yep.
It'd be a lot without them. I'm not saying that isn't a good means of communication. I'm doing all my therapeutic work this way, as imagine, and training, everything else that I do professionally. But it's really hard, and maybe with vaccinations ramping up, we'll get past that. But that it's hard. It's been a year.
Yeah, that's right. I agree with you, and I would imagine that our listeners have had a whole boatload of experiences that they're trying to take on board and sort through. And I don't know if there's an opportunity in this medium to tap into. Do they have a chat function or anything where they're able to ask questions? Or
Yeah, in this medium, we're not doing it live, so it's not. Unfortunately, when you do your webinar, it will be, and they will be able to ask questions. And those will appear in the sidebar, and Carolyn can actually just have a question and answer time if you'd like to, ask those questions.
Just in this then, Lisa, what kinds of questions might we imagine that viewers could have for us as we draw down into our last 5 or 10 minutes?
I think one question a lot of people have is, what would you recommend for help for grieving during this time? If you do lose a family member, a loved one, or a complex relationship one, as you mentioned, is there anything you would recommend to people to that grief?
Well, one thing is, I might say, reinvent ritual. That at a time that is largely de-ritualized, and even for people who are, part of a faith community or something, or maybe they have a funeral celebration and it has an online component, that can be a very distancing medium, right? We don't really have that participatory feel. It's not like standing in a receiving line to receive a hug at the end of a service, and so with that, there is the challenge to think, how can I actively participate in this? How can I also solemnify the event? If I'm let's say we're watching on the screen rather than my sitting and looking at my computer and watching the memorial service for, my friend or my mother. Um, can that be something where we bring the family together? Maybe the kids light some ceremonial candles around the room. They too can participate in the ritualization. We watch the service. We close the laptop at the end or turn off the big screen TV, and then we have story time for the next half hour. We share, what do you remember about Nana? Here's a funny story I don't think I've ever told you. And maybe we adjourn then to a family meal where we feature some of the dishes she might once have made or enjoyed. And so we can creatively begin to, in some way, construct rituals of remembrance and rituals of renewal. What can we do now that would help us move forward? Not from her, but with her. How can we keep her stories alive? Maybe we share them in a Facebook page that's converted to a memorial page, and we post some pictures, and we ask the kids what pictures they'd like out of these 10. What would you like to put on? So I think that there are ways that we can find voice. We can give grief voice, but we can give continued love voice as well. And we can do it together rather than only in isolation or in the dark recesses of our own private heart.
Yeah. Yeah, I think that's really important. And I think that, doing something that helps us remember the person and bring them along with us in that way is important. I was talking to somebody who said, it's not like you don't want to just move through grief. You want to make meaning out of that, or make,
right.
Something. You don't want to get over the person. You want to, remember them and make, how do you make them a part of your life now? Like you said, changing your relationship to them.
Therapists in a narrative therapy tradition, Michael White kind of tradition, Dave Epstein tradition, speak about saying hello again rather than saying goodbye. Mm-hmm. How do we remember the person, reclaiming their membership in the ongoing club of our lives? It doesn't get canceled at the point of their death. Death changes the relationship, but it need not just relinquish it. Yeah. And so we look for ways of, even though I'm secular in my celebration of the holiday period, I have a Christmas tree, and there are ornaments on that tree that have special meaning, right? That honor my mother and honor the birth of my kids and honor others who have died. And hanging those in a normal year where other people would be in the house with me at least would occasion storytelling. And so in simple ways that are appropriate to who we are and whose we are, we can acknowledge these continued relations with those we have loved and not lost in an emotional sense.
Yeah. And I think about what you said about narrative, about creating a coherent narrative or story about the person, of our experience with them, and you mentioned the writing that your Dutch colleagues are suggesting, but that seems really important because, trauma is one thing. It obviously affects us, it impacts us, it informs who we are, but it's unresolved trauma that really haunts us.
That is really well said, right? Trauma affects us, but it is the unresolved trauma that haunts us. And I think you're exactly right. And I do a fair amount of work in China and other culturally Chinese countries like Singapore, Taiwan, and they share a concept of the hungry ghost who comes back haunting because of something unresolved. Often in the relationship. And these are the kinds of times and the kinds of circumstances, as our research clearly demonstrates in very scientifically rigorous statistics, these are the kinds of circumstances that are associated with a hungry ghost feeling of haunting losses. We need to find a way of materializing and renegotiating our relationship to them. and finding a place for them in our changed lives.
Yeah. Yeah. And that's why I think, when you said also about trauma informed or person, seeing somebody you can talk to understands the impact of trauma, because
Right.
the way people are losing people right now is often traumatic.
Yes,
It's
that's
often
exactly right.
sudden, it's often without, like you said, no time to resolve unresolved things or have words said of any kind, often on the part of the person who's dying, who's intubated or isolated from us. Yeah, I think that's so important, that idea of having a way of doing some of that and helping people through that is going to be really
Well,
important forward.
within the PI, the Portland Institute framework, what we try to do is we consider this meaning-oriented grief therapy kind of as the big tent or big circle, and then within it we have trauma-informed approaches when people are struggling with that, and attachment-informed perspectives and practices, that because people are often struggling with that, and the difficulties may come up in either of those domains. So how do we facilitate, work with the trauma, the integration of that, the trauma story, but then also how do we reaffirm the attachment bond that has been challenged or that is problematic? And so that's what we're trying to do, is we're looking at the problem, but we're also looking at the person.
Mm-hmm.
And we're trying to give equal attention to both when
Mm-hmm.
people bring forward a complicated grief that they're trying to sort through.
Right. And it often, there's some trauma involved with it or some attachment issues that are unresolved. Yeah. I find that a lot. The unresolved attachment issues
Yeah,
make loss really difficult.
yeah, that's exactly right.
No time to repair. And again, those are, I've done a lot of work on the attachment piece. Dan Siegel and I did an e-course on
Yeah, yeah,
resolved attachment wounds, because
yeah, yeah.
of that. Part of it has to do with writing a coherent narrative
Mm-hmm.
about what happened to you and understanding what's probably a really complex relationship with those early caretakers. It wasn't all good and wasn't all bad, because rarely are people demons or angels. They're human. They have all kinds of shades of gray, that are
That's right. And it is a subtle thing, but it's an appropriate thing, whether you're looking at it in classical kind of sort of object relations terms, or in terms of, I know your practice of voice therapy would be an example of a very hostile interdict in that way, a very harsh internal critic. But we also have, contemporary frames like IFS, internal family systems, dialogical self models. We recognize that we may grieve a part of another person, whereas we may experience relief in relation to another part that is no longer there. And different aspects of us have different responses. The little boy in me still grieves my father's suicide when I was 11. The man in me has accommodated that in the ways that he can, and tries to be compassionate with that little boy. And so the grieving moves us into a very intimate landscape of work, but also an intricately social landscape of work. And so almost every major school of psychology has something of great value to contribute to this work. Whether we're working with systems, couples, individuals, whether our view is grounded in a psychodynamic perspective, a humanistic one, an existential one, a cognitive behavioral one, a constructivist one. We have a panoply of perspectives, but we often need to enrich all of them when it comes to looking at matters of grief, because mostly grief is a side issue in each of those perspectives. But it's, especially in this era, it's a central issue with what many people bring forward.
Right, right. And I like what you said. It's, not only different parts of the person you might have different feelings about, there's different parts of you that have different feelings. There's the part of you that might be relieved, and the part of you that really grieves, and the part of you that, has confused feeling. I mean, it's different,
Right.
it's complex within us as well as between us in this process.
I had again, a conversation with I mentioned, I think, this Orthodox Jewish friend whose father died. One of the things she did that was very creative and helpful, was suggested by a therapist she talked with, was to write a letter from her therapist self to the grieving daughter within her. And that therapist had the most wise, compassionate things to say. It was tapping into a voice of her own wise self, and a loving part of her that I'm sure was partly modeled on her secure relationship with her dad. And she said it was so healing to be able to begin to bring together these two parts, and to have that, the skillful therapist within me also gently and compassionately hold the grieving daughter, to affirm her worth, her skill, her love, her pain. So I do think we need to be able to attend to the internal complexity of grief. It's not just a set of symptoms that we try to mitigate and get through. It's much more.
It's much more, and I think that's such a beautiful idea. I may borrow that idea. That idea, part of yourself that is more compassionate, is wiser to deal, to help the part that's grieving. That's such
and that can be phrased in a way that is appropriate to any person, regardless of his or her or their beliefs. What does the Buddha within you suggest about what you need now? With reference to this attachment, or the place of suffering in your life, or it could be, what does this, if Jesus were talking to you, or if Muhammad were to write you a letter, what would it say? It could be any of a variety of ways that people could draw on a spiritual or philosophic tradition, a wise and compassionate figure in their own lives. Maybe your grandmother was an important figure for you, and what would she say about the circumstance you face now? And so there are so many creative practices on which we can draw. I just have a third book now called Techniques of Grief Therapy, New Techniques of Grief Therapy, that's in press with Routledge, and has two successor volumes, all of them completely different. And they basically harvest the wisdom from the field of practice of hundreds of therapists who contributed some of their most creative methods to working with grief, and briefly in a few pages described in procedural detail, anchored in a case study. And what you get when you open the pages of these books is you see the wealth of clinical richness that our field can generate, but that often isn't circulated enough, so that as therapists, we are left saying, God, what do? I can't bring their loved one back. I mean, it's like, okay, I can kind of try to mitigate their depression or something, or tell them to keep going, or time heals all wounds. But we can do much more than that. We can be much more helpful than that. And
sounds like it would be a good textbook for courses in graduate school about grief therapy.
It is used for that as well. It is used for that in a number of schools, because it's very concrete and practical. So people can look it up if they're interested. Techniques of Grief Therapy, and there's are 3 volumes that differ only in their subtitles, published by Routledge.
Okay, yeah, no, that's a resource we could put on the page about this conversation too, that people could access.
I'd be happy to do that.
Yeah.
Well, I've appreciated the chance for this very meaningful conversation. I don't know how much time we have, but it's been generous of you to offer this.
Oh, thanks. I really appreciate it. I just felt like, it's such a topic on people's minds right now, and such a topic that people are dealing with. And like your research shows, it's really, really complex and difficult for people. And I just thought it would be really important. And I was thinking, okay, grief. Wait, Bob Neimeyer. No, I know who to reach out to. No, I really, really appreciate you doing it, because I just feel like you have a wealth of knowledge, and what you bring to this subject is so important.
Well, it's clear that you also do, and I think virtually all of us who are tuning into this podcast whether we are animated by the grief in our personal lives, animated by the suffering of the clients we attempt to walk alongside, or both, and most commonly both, then we bring a readiness to do something more of a helpful kind with our grief and that of others. And there are resources available. There are prospects of training available. There are sources of inspiration. Every tradition of therapy has something to give to this. So it's good to mobilize some conversation about that of the kind that you're stirring up here, Lisa.
Yeah. And I think for people themselves who just had so much loss, whether, like you said, it's usually both. We're trying to help others and we're trying to help ourselves with this difficult issue. And, at the beginning of this, we really didn't know what we were going to be going through.
No.
And, and even those who've, been able to keep families safe, it's, so, it feels so tenuous and difficult and kind of like we've been bracing for the worst,
That's well said. It is a tenuous time, and much about it is unpredictable.
Yeah. I've just been seeing that from all angles, but I for myself, for my friends, for people I work with, I just feel like this is such an important thing.
Mm-hmm.
Yeah,
and I do think that as therapists, if we are unable to look at our own lives and losses, we're far less capacitated, far less ready to do that with our clients, because too much of what they bring will trigger us and we'll respond in a way that, just our own self-protectiveness will kick in and we'll kind of soften the question or circumvent it or not really address the heart of the pain. So it does call us into greater consciousness and greater compassion regarding our own lives and losses too.
Yeah. And I think that makes us better people and better therapists.
That's right. Because therapy does begin with who we are and extends to what we do. It is about being in some way more than doing, though the skills will augment the basic human relation. But when we're not showing up in a full way, offering that gift of non-anxious presence as the starting point, we're just not able to be nearly as effective. We don't provide the container for people's experience that they need, what George Winnicott once called a holding environment.
Yeah. I think we get, and if we focus just on the technique or try to do it just by technique, it doesn't offer the same richness or real feeling that people need to get through things or process through things. And, if we're not willing to feel, we dampen down the feelings of our patient. Unfortunately, they don't get to feel what they need to feel. And sometimes they need to cry or sometimes they need to just, be with the feelings of their grief.
That's
and
right.
Be able to tolerate that to do good therapy with them.
That's right. It's not a rush through it. It's not a there, or try this and it'll all be better, or learn this skill. All of those things, constellation and skill development take place, but presence to the pain, the willing to name it and claim it and sit with it in a kind of compassion-based therapy, that's where it begins. We need to begin where our clients are, not with where we are. And so that's kind of, I think, the starting point. It's the container for all of it. It's the base of the pyramid.
Right. We can't just, sidestep things and go around them. We have to go through them and going through the pain. And, even if that taps into our own pain, which it probably will and should, for being human with somebody.
That's right. And should. And that's okay. I think when we can build a kind of bridge into the life world of the client and then cross that bridge and take up residence in some way in their field of relevant emotion and need, then from there we can help them map the territory that we find. We can find a way forward together. But it's not like a Google map that we just impose on their experience and say, turn right on I-5. We don't know that until we're on the ground with them on the same terrain. And that requires the empathic imagination and the willingness to step toward rather than away from the things that are of greatest distress to them, and also the greatest joy. I think sometimes in therapy we neglect the affirmative affect as much as the negative.
Yeah, and I think that's just as important. And even as you're grieving, to go towards that, that's what you're talking about with the balance towards the grieving, but also towards life. And, how do they manifest their joy? And, that's really important too. It's not like, because you're grieving, you're not allowed to have any joy,
Well, my friend Terry Rando asks a simple question when grief is not simple. When people seem to be stuck in a ruminative, preoccupying grief that month after month after month after month is unchanging. And she may ask the question, Lisa, is it okay for you to be okay? Would that be okay for you to really be all right? Is joy a condition that you can allow yourself to know once more?
Yeah.
And if the deep answer is no, maybe not, then that's where we need to start, is what is the pro-symptom position, as my friend Bruce Ecker would call it, that makes that the maintenance of the suffering in an unchanging way more important to have than not to have, despite the real pain associated with it, right? Maybe I feel like if I laughed genuinely, I'd be betraying my loved one.
Right.
If I really found a way of moving forward, I would move away from them. Maybe everybody else has moved on and I'm now the one loyal witness. Maybe I feel closest to my child who has died when I'm in my grief. Maybe it's only then that I really, there can be a myriad of reasons why people can end up at the level of the meaning of the mourning, needing to maintain it just as it is. And that can be a huge factor in complicating our grief. So this is the subtle work that we do around meaning making in grief. Not only trying to make sense of life, we're trying to make sense of ourselves in light of the experience. And especially the aspects that, in a way preclude our adapting to the changed world. We just reside in a past that was known, and we find ourselves unable to step toward a future that is not.
Yeah.
So that can be sometimes the work of grief therapy as well.
Yeah. I think that's so important, that idea of when people get stuck, that is it partly that they feel that they'd be abandoning their loved one or not really honoring them if they moved on and had, in the sense of having joy too.
Right.
Yet, if you really think about it, most people that we lose would want us to go on. They don't want us to go on. But it's hard. It can still feel really difficult.
Yeah, and if part of where those loved ones live now is in our hearts, what kinds of heart space are we offering them as their abode? Is it a dark heart filled with bitterness, acidic resentment, despair, anguish? Or is it a heart that is filled with joy and gratitude and appreciation for what was good and still can be again? Is it a life that moves forward or a life that ended with theirs? Does our broken heart still beat? And so I think these are challenges, but they are not impossible to address. They just require creativity and commitment and compassion to do so.
Yeah, definitely. Well, thanks so much for being here with me today, Bob, and talking about this really important subject. I really appreciate it touched me to feel about it and to think about it, and I really appreciate it.
Thank you. I'm touched by your clinical flexibility and wisdom and insight as well, Lisa. And, the good work of the Glendon Association across these decades has, I think, brought good things into the world and into discourse. And I appreciate your letting me be a part of the team temporarily.
Great. Well, anytime you want to be part of the team, you can have a home. Thank you so much.
All right.
Okay.
Thank you, Fred.
Bye-bye.
Bye-bye.